Um, Not quite yet, but let me just go ahead and do our introduction. I know that everybody here is aware that we start at 1:10, and I know that Isa's presentation is going to be a giant chunk of the time window that we've allotted for this. So I just want to make sure that everyone's aware of that. I hope that we will have some time for Q&A afterwards, and I think that Isa will be happy to stick around. I know I will to help sort of navigate a Q&A if any of you have questions or comments about the presentation. So it is 1:10, and I want to go ahead and get started. My name is Neil Anderberg. I'm a professor in the Business Administration Department, and I'm a professor in FYS2. And Isa is a student of mine in my FYS2 class with my co-professor, Carmen Huxley, who's in the room here in support as well. So Isa is a first-year pre-nursing major, and she has bravely taken our suggestion to join us in this academic symposium and present a topic that is near and dear to her heart. And so without further ado, I want to pass it on to Isa Valencia. Please share your screen and show us what you've been working on.
Okay, cool. Hello, everybody. Thank you so much for coming today. My name is Isabella Valencia, and I will be sharing with you my research on unequal access to healthcare in the Philippines and how we can have equal access to healthcare in the Philippines. This presentation will be from a business and philosophical standpoint, which I learned from my first year seminar class taught by the amazing Professor Anderberg and Professor Huxley. I chose this topic because as a second generation Filipino American, I think it is very important to spread awareness about the understated issues of the Philippines and how we can build a community to achieve justice for everybody. So before I get into detail, this is a quick overview of what we will be going over today. I will first start with what is the issue behind the healthcare system, how inadequate healthcare and social class relate, what are the consequences of inadequate healthcare, what are the obstacles in slowing down our progress in achieving justice for all Filipino citizens, and finally, how we can have equal access to healthcare. So number one, what is the issue? The healthcare system has been fragmented for decades. We are in a current state of retrogressive progress. So instead of moving forward with the healthcare system, we are currently falling behind. Yes, we've made some improvements such as insurance coverage, government funding, more hospitals. However, insurance is still too expensive, government funding is not enough, and these hospitals are built in a small area. They are not evenly distributed throughout the country. There's also a policy called pay first, treatment later. No matter what medical condition you're in, if you go to the ER, the clinic, whatever, you will be charged a fee. This is very difficult for low-income Filipino citizens who are in terrible or in unhealthy conditions, and they're expected to pay a bill that is too expensive for them. And this has happened to my relatives also. The healthcare system has worsened since the COVID-19 pandemic. So instead of relying on public health experts, the government relied on a 100% lockdown, which is a military approach to mitigating the virus. Although their intentions were to prevent the spread, this 100% lockdown still, there was no improvement whatsoever. Hospitals were overworked, doctors and nurses were overworked, and it was just terrible. So how does inadequate healthcare and social class relate? Specifically, how does this relate to lower income workers? So to give a quick background, low income workers usually move from other areas of the Philippines and live in the cities, like the urban cities, to find jobs. There's not much they can afford, so usually they live in places like this picture right here, which are the slums of the Philippines. These neighborhoods are densely populated with big families and small homes built around mountains of waste. This alone already creates a hazardous environment for low-income Filipinos, which affects their own personal health, but also their work ethic. There was a study in Tondo, Manila, which is one of the most infamous slums in the Philippines. 6 researchers went out to study the effects of low income and the quality of life of these people. As expected, the quality of life was pretty low, and there was a high prevalence of tuberculosis because of the dense population and also just the trash surrounding them. Because of this, these people are not able to work as well. They cannot work to their fullest potential, which kind of prevents them from getting a promotion or even showing up to work every day. And because of that, they cannot afford to go to the hospital to be treated because of the pay first, treatment later policy. This puts low income workers in a vicious cycle between declining health and economic instability. So what are the consequences to inadequate healthcare in the Philippines? Economic decline. On an individual level, these people are not able to support themselves or their families. On a macro level, yes, inadequate healthcare does affect the whole economy. Foreign businesses will look at the Philippines and think the government can't take care of their own people. I'll just set up my business in another country that will guarantee the success of my industry. This is a missed opportunity for the Philippine economy. Tourism is also affected. If this image right here is what people think of when they think of the Philippines, they probably wouldn't even go there at all. Inadequate healthcare sets up the society for social immobility. This is more of an informal caste system in which low-income workers who can never afford healthcare will always be in the lower class because they cannot be treated and be healthy enough to work well and maybe move up the social pyramid. On the other hand, higher income workers will always afford healthcare so they can stay at the top. This is a quick video clip just to give a visual of what we went over in this presentation so far.
Manila, the capital city of the Philippines, a business hub plagued by economic disparity. As the city progresses, 35% of its population, or more than 4 million, still reside in slums. They are laborers who have to contend with meager incomes of less than $2 a day.
Napakahalaga na makilala natin sino ba talaga nagpapatakbo nito at bakit yung bumubuo at nagpapatakbo ng lungsod nananatili sila sa kahirapan, hindi nila natatamasa yung yaman na pinapakita o yung pinoproject ng lungsod.
And now Manila has become the new epicenter for the coronavirus outbreak in Southeast Asia, with slums considered as viral hotbeds for the transmission of the disease.
Space is a luxury for the rich. So the poor, they live in small homes, in crowded, congested communities. The vulnerability, of course, with any sort of infectious disease, it's the enclosed space, the close interaction, the amount of people you're interacting with.
The capital city of...
Sorry, let me go back to the clip. Okay, that was it. Anyway, that was the last few seconds. But the biggest takeaway of this video is with adequate healthcare, we can create a cascade of improvements, such as a better economy and a better quality of life for all Filipino citizens. So before we get into how we can have equal access to healthcare, we need to identify and overcome the obstacles that slow us down. Colonization and imperialism. The Philippines suffers from a long history of this, from the Spanish to Japan to the United States. They were constantly being conquered by these imperialists. This sets up the Philippines for colonial mentality. This is the subservient mindset that they have molded because they see themselves as subordinate to the imperialist. This leads to colonial debt, in which Filipinos basically have to learn how to accept the situation they are in no matter what. If they're living through injustice, they have to live through it. If they were to ask or demand for more rights, they would be seen as ungrateful and also selfish. Imperialism has left the Philippines behind with political corruption, and this led to a suffering economy. Because of the suffering economy, we have a lack of resources leading to underdeveloped technology. Philippines is currently behind in medical advancement by at least a decade. This results in insecurities in the nation's abilities, not only politically and economically, but also socially and culturally. But ultimately, how do we work with the oppressed? It all starts with self-care, and I decided to use Thich Nhat Hanh's ideology on mindfulness because he promotes the importance of helping yourself before helping others. And this is through his process of metta meditation. So this is where you cultivate self-love, compassion, honesty, and truth, and being truthful with yourself, which is easier said than done, to promote your own individual growth. When you grow as a person, you're also able to help others around you and pull them out of their suffering. With metta meditation, we have to practice mindfulness. I highly encourage self-care for our advocates, because if you're not able to help yourself first, you will spread yourself out too thin, and you wouldn't be in good condition to help the oppressed. It is also very important for our leaders to practice metta meditation and practice mindfulness, because we want those proactive leaders to support the whole community. We don't want someone to make up policies that will benefit their individual self so that they can get all the benefits. You want to share that and focus on the greater good. I decided to use this quote from Thich Nhat Hanh because I thought it was very fitting for this presentation today. As we become aware of the feelings in us, our self-understanding will deepen. We will see how our fears and lack of peace contribute to our unhappiness, and we will see the value of loving ourselves and cultivating a heart of compassion. The next thing we need to do is reduce the brain drain of nurses. I learned this concept from the business module of my first year seminar class. This is where highly trained professionals leave their country and pursue their career somewhere else that will guarantee economic opportunities or better economic opportunities. So nursing is one of the most popular degrees in the Philippines. If you've been to a hospital, you've probably seen at least one Filipino nurse walking around the halls. The graduates increase by thousands every year, but we face a nursing shortage of 20,000 people. Why is this? Like I said, imperialism and colonization. 30% of nurses migrate to the United States, and this was because we faced a long history of benevolent assimilation. So this is what the US claims as a good kind of colonization, in which they will promise a better future for the Philippines with better infrastructure, improved education, healthcare, if these people leave their country, work for the United States, and take the jobs that other people didn't want, which during this time was nursing. Obviously, these promises were not fulfilled, except education, because they were educating these people so that they're ready to leave the country and work somewhere else. So they weren't even working in the Philippines. And this led to an ongoing tradition of nurse migration. Even though we are in a nursing shortage, the Philippine government supports this. Why? Their economy benefits. So if Filipino nurses migrate to the US, they're sending money back to their family, and the Philippines and the US both make a profit from just transferring the money. So both economies benefit. Philippines is happy. The people, especially lower income workers, are not happy. Ultimately, how do we resolve brain drain? It honestly depends on the willingness of the individuals to go back. We can promote this through active communication with their families to encourage them to stay and be together as a family. We could also offer traveling nurse rotations. With airfare covered, Filipino migrant nurses could go back and work at an assigned hospital for maybe 3 or 4 months with tax incentives, better wages, and then once their time is up, they can go back to the US or wherever country. Oops, let me go back real quick. And along with nurse rotations, we could recruit foreigners and volunteers, possibly from the Peace Corps, to support these nurses, and they can work together in the hospitals. What can the government do specifically? Honestly, improve the quality of life. And this starts with investing in better healthcare. So healthcare is literally like the core of all solutions. Achieve political stability. This is a challenging feat, but is possible. Offer tax incentives to healthcare workers, so lower the tax of nurses and doctors. And promote and utilize modern technology. These migrant nurses who, if they are going to fly back and work in the Philippines, they have to work with the machinery that they're used to working with in other countries. And lastly, build more hospitals, and not only build hospitals in Manila only or like certain cities. You gotta evenly distribute it throughout the countries, especially in rural areas where there is minimal access to a clinic or a hospital. Lastly, we can all be advocates. I define advocacy through Paulo Freire's critical pedagogy because he promotes the importance of community building and empowerment. So first, we have to understand the challenges of the oppressed. We can't move on and find a solution if we don't know where they're coming from. And this takes empathy and also cultural competence. We have to start with what they know. The oppressed are our teachers, and us advocates are the students learning from our teachers. And when we learn from each other, we can expand on their knowledge to find solutions. And finally, have Filipinos speak their needs and demand their rights. As advocates, it is our job to empower them and give them the confidence to go out and achieve the justice that they need. And I chose this picture right here because honestly, all the pictures earlier were so sad. So I need a happy one with everyone being optimistic because we can do this, guys. Like it's challenging, but it's possible. There's my work cited. And thank you everyone for listening, or as they say in Tagalog, salamat po. So if you have any questions, please type in the chat or unmute your mic. And hopefully we have time for questions because I'm really excited.
We do have a few minutes, and Isa,
Okay,
that was
cool.
great. So thank you so much for that. We will take questions from the audience, and I just want everybody to be mindful that I think the next session starts in a couple of minutes. So if you have a question, happy to take it now with what time we have left.
Okay. Should I stop sharing my screen?
You can keep it up if there's anybody that wants you to go back to a slide or something like that.
Okay.
Do I see any hands? Any questions out there? It's all rounds of applause for you, Isa.
Oh, wait, really?
No questions.
Okay, cool. Thanks, guys.
It was yeah, great job. I'm gonna echo Monse here, but I'm wondering what was your inspiration to begin your study in the Philippines and wanting better access to healthcare there? What was
Um,
your impetus or reason for your
This,
presentation?
this all started with the pandemic. I mean, like I have a lot of Filipino, or I have a lot of relatives in the Philippines, and there's so many times where we get a call from back home and I just hear like a story like, oh, she couldn't get her medicine today because we couldn't afford it. Or there's this one situation specifically. Sorry, it might be a little bit brutal, but my grandma's brother actually got stabbed to death. And when he went to the hospital, they were asking, like, he was already bleeding and bleeding. And they asked him, can you pay this fee first? Before even, like, there was no doctor that ran to him or anything. Like, his friends were like taking off like their jewelry, like, I'll pay with this, I'll pay you later. And they didn't accept it. So he just sat there in the emergency room. And unfortunately, he passed away. And this happens a lot to people, especially those who can't afford it. And honestly, this is what inspired me to do research on this topic, because I feel like I don't hear about it enough. So I feel like I could be that person to spread awareness about this issue. So yeah. Any other questions? Or thank you, Professor Huxley, for asking. I like that question.
Thank you for sharing that, Isa.
Yeah, of course.
I was also just kind of moved by the parallel also with environmental justice that
Mhm.
kind of runs as a thread through your presentation.
Thank you, Dr. Layden. Yeah, honestly, the environment does play a big role in the health of Filipino individuals. So that like give me some inspiration. Like maybe if we work together to fight against climate change and just environmental injustice, then that will also connect with improving healthcare as well.
Health is wealth, Isa. And you're right.
Yes, I read that article, Professor Enlightening.
And this does, what you've talked about covers so many different aspects of society, and a lot of different departments right here at the Mount, beyond obviously the philosophy and the business modules in your FYS course, right into politics and beyond. So I think you did a great job. Thank you. And thank you everyone out there for joining
Yeah.
to listen to this. I think I saw 37 participants in here.
Yeah, thank you everybody. It was so nice of you all to watch me. I was like, what if not enough people watch this?
Well, thank
And
you.
you're also recording it, so that's wonderful.
Yeah, I want to share it with my friends and family too, who aren't able to come today to the meeting.
Well, that's
I
great.
also I'm sorry,
Go ahead.
I put in the chat, another student today gave a presentation. It's somebody you might want to reach out to. There's some collaborative possibilities in terms of how your work, how you might support each other.
Okay, thank you, Dr. Layden.
Mm-hmm.
That's great. So if anyone has a 1:30 that they've got to go to, that has now started. I want to thank Isa again for her presentation. You've done a great job.
Thank you all for listening.
And I'll see you in class tomorrow, but thank you all for attending, and I hope you all enjoy the rest of the Academic Symposium today.
Thank you, everybody. Oh, wait, do I leave too? I'm like confused.
I'll stop the recording and then I'll find a link and send it to you, okay?
Okay, thank you. Bye.